Hey everybody, this is Dr. Pat from the Springfield Wellness Center, and today we're going to be talking about knee pain, and specifically what are 3 different self-tests you can do to determine what may or may be contributing to your knee pain and what part of that problem is. Knee pain is one of the most common musculoskeletal conditions out there. It's something that millions of people suffer with, and if you know anything about knee replacement surgeries, they're in the hundreds of thousands every single year. And so it's a super common problem that people have. And part of the reason why it is it's in the lower extremity. And in the lower extremity, that's where we carry a lot of our weight. And especially in a country where a lot of people are overweight, we tend to see a lot of knee trouble that stems from something like that. Now, what we're going to go through today are 3 little tests that can be done in order for you to get an idea of what may be going on inside your knee. Now, I do want to stress that the only way to really know what's going on is to have a full exam with a healthcare provider, like a chiropractor, for example, who can really identify what's going on and provide the right tests and any imaging if necessary. So to start out, I'm going to start with one exam that's pretty simple, and it's called inspection and palpation. Now, inspection really just means to look at it and assess it. And so what you would do is you would raise up your pant leg and you would see and check the knee and look for anything like redness, inflammation, any discoloration that shouldn't be there. It just really gives us a good understanding of the fact that if there's inflammation in there and if there's any type of inflammatory arthritis going on. So this would be things like rheumatoid arthritis, could be lupus, could be any number of those types of conditions. And so it really helps us understand that if there's swelling involved, there could be some type of arthritis in there, but also some soft tissue injury, so damage to the ligaments, to the tendons, anything in and around that knee area. So it's always good to start by just looking at the knee, comparing side to side between the knees to really get an idea of what's going on. The second test that we're going to do is range of motion. So we want to actually move the knee through its classic motion, which is flexion and extension. And what we want to pay attention to is how smooth that movement is. Since the knee should have lots of joint space and lots of that joint fluid, that synovial fluid in there, we want that movement to be really smooth, because what that fluid does is lubricate the joint and make it a nice smooth motion. If you're experiencing things like crunching or grinding, that could be an indication that there could be some degeneration going on in there, which would be arthritis. And because what happens is those joint spaces get closer together and the bones start to rub on each other, and that's what causes that kind of friction, grinding, crunching sound. And so when you're bending, you just really want to see and assess and even listen to what you hear and what you feel in the knee area. And the last test that we can do is called Thessaly's test. And what this does is this assesses for any meniscal damage or any cartilage damage to the surfaces of the bones in the knee joint. So for this one, we actually stand up, and using a table or some type of support, what you do is you go up on one leg, you're going to bend the knee, and you're going to rotate. And what the rotation does is it puts a lot of stress on one side of that knee joint, because there's cartilage on one side and cartilage on the other side. And so we're going to come down and rotate out and also rotate in. And what that's doing is stressing both aspects of that cartilage. And if it's very painful, there may be some cartilage damage to those meniscus in there, okay? Now, again, I want to stress that in order to fully understand your knee condition, a full exam does need to be done. But these are just some things that can be done at home that you can start to understand your knee condition a little bit better and give you an idea if pursuing care with a healthcare provider is something that you want to do.